helped him recover and did an incredible job, and this is my payback.
Tess, can you use the microphone, please?
Sorry, I'm pointing it in the wrong direction. Kate Stanton Davis, Jensen Barnett, Ella and Lola Green, Sophia Hodges, Oliver Smale, Jack Byrne, Kyle Hall, Graham Scott Holmes-Smith, Ivy Morris and Pippa Griffiths. These are the names of the babies that we know of who died avoidable deaths in this country, in this county, between 2009 and 2015. 11 small lives lost as they barely began. Health Secretary Jeremy Hunt has ordered an investigation into the deaths of the babies in Shropshire's maternity services. And how does the medical director of our hospital respond? By saying, and I quote, "When I look at the perinatal mortality rate at our trust, compared to the rest of the NHS, we are at an equivalent level to the rest of the country. The coroner and the courts have found that babies in Shropshire have died avoidable deaths. Every one of those deaths is both a tragedy and a disgrace. Hiding behind averages when babies have died is an egregious affront to the grieving families and exposes Dr. Borman's position as, I believe, untenable." How many more babies have to die in Shropshire's maternity services as a result of hospital mistakes? This is a scandal on a par to the Mid-Staffordshire scandal, when senior managers were so fixated on targets and cuts that patients died in large numbers. The worst scandal in the NHS history, and we are on the brink of the same scandal here in Shropshire. In Shropshire, we have a comparable tragedy now emerging to that of Stats. The NHS is in crisis nationally and locally. In the UK, we spend far less on healthcare than comparable countries. And the NHS is being starved of essential funds. It's why ambulances are missing their targets for emergency response times. Locally, things are even worse. Shropshire and Telford and Wrekin have above average health needs, but we're the 6th worst funded area in the country. We've asked our MPs to fight our corner in Parliament to secure funding that we need, but we have been abandoned to the ravages of their government's brutal cuts. Our sustainability and transformation plans, which have been unopposed by our MPs, is about cutting £135 million a year from local healthcare spending. Our community hospitals face bed cuts and they want to rob us of an A&E, despite the fact that they're both already stretched beyond capacity. Our local political representatives have failed us. They have failed to fight to secure sufficient funding from Westminster for our local NHS, and that includes retaining both A&Es, Women and Children's at Telford, and funding to secure Women and Children's at the RSH. Not because we fancy it, but because we need it. Shropshire needs a fair share of funding, and we're not getting it. We need an NHS in the UK to get the same funding as healthcare systems in comparable countries. We need a government that invests in the NHS workforce for the future. The scandal of the babies dying shows what can happen when organisations lose their way. Without funding for the NHS, more deaths are inevitable. There has never been a more important time to fight for our NHS than now. And there is no more powerful a place to take that fight than the ballot box. So I plead with you, make the right choices when it comes to putting your X in the right spot. Thank you.
Thank you for that, Tess. Right, now we're